So when we started to look at this, we decided to construct a research project where we would compare having a home video conferencing unit in the parent's home as compared to the normal telephone support that would be available in routine care. And what we wanted to look at was, did putting a video conferencing system into the home affect how we manage patients? Could it benefit those who were getting into some difficulty? Would it reduce the parental anxiety for the parents at home? How it would change health service utilization, such as visits to the GPs or admission to the hospital? And finally, to do a cost analysis of video conferencing support. So we decided to have 3 groups in this initial work that we did, and this was done with 2 of my colleagues who were trainees at the time, Dr. Brian McCrossan and Dr. Gareth Morgan, both of whom are consultant pediatric cardiologists now. We had 3 groups, one where we used the video conference. The second, we decided to use a telephone support just to try and elucidate there that it was actually the seeing of the person that made the difference, as well as hearing from them. And then the control group were your patients who had no additional support as compared to what they would normally have had prior to the initiation of this research. When we started out the work, we inserted into the home a small video conferencing unit. One of the key elements that we found was that most people now have some knowledge of technology. It's hugely important that it's not a complicated device, and when we inserted the devices in the home, we set it up so that the parents and family, the only thing they had to do was to switch it on, and then we would connect through to them. And as time has gone on, we've been doing this work now, I suppose, for close to 12, 15 years. What we have found is obviously that there is increased availability in the homes for patients with their own broadband. We started initially out as ISDN lines, but in our current practice, it's broadband. One of the key parameters for children with complex heart disease is their oxygen levels, and so we felt it would be very useful to provide the families also with a small portable pulse oximeter so that parents could measure the oxygen levels, and then indeed we could see that whenever we went into the homes. And that was the object of our project, to try and have a regular contact with these parents, and during the research project also for them to be able to contact us outside of a scheduled visit.